So Destination Home was formed out of a convening called a Blue Ribbon Commission that was chaired by the mayor of San Jose and the president of the Board of Supervisors for Santa Clara County back in 2008. And there was a big effort then around shifting our community from managing homelessness to ending it, which is something people still talk about, right? How do you do less of the immediate things and invest more in the solutions? A public-private partnership convening organization for strategies to end homelessness. There was a federal mandate in early 2000s that said everybody had to have a 10-year plan to end homelessness. And so our community created a 10-year plan. Those were expiring in 2013, 2014. And so we said, well, we need a new 10-year plan. But one of the things that we had done was San Jose had a plan to end homelessness. The county had a different plan to end homelessness. Nonprofits had different plans. And so we said, well, let's all do together, have one plan to end homelessness for the whole region that we all agree on, we all adopt, we all say, okay, this is sort of our guiding principles. And so we led the facilitation of that, which was the community plan to end homelessness in 2015. And that has been endorsed by all the major jurisdictions in the county. For us, it's been about collective impact. So we've been really working hard with a lot of our elected officials and partner cities to say these are the things that work to end homelessness. We did a proof of concept in about 4 years ago around chronic homelessness. Said we're going to house 1,000 people, show you that it works. 86% of everybody that was housed is housed after 12 months. Did a huge cost study that said this is how much money we can save if we do more of this. And so really a lot of talking around why this is beneficial for cities. And so of course cities still run up against challenges, right? Neighbors are complaining about an encampment, enforcement has to happen. But generally I feel like our community, we put a lot of energy into investing in education around housing first, why housing is important. But there's certainly been a lot of, community concern around homelessness, especially in certain populations. And so I think this really, we've tried to use data and information and also having people involved with Destination Home that are well respected and influential and able to say, hey, this is what we're supporting. Can you support this with us? Right. It's really a community response, and collective impact is a model that I think is perfect for something like homelessness. There's generally with collective impact what's called a backbone organization. That's combination cheerleader, convener, sort of cattle prodder, right? Like making sure that this stuff is all happening, and that's the role that Destination Home has fulfilled. But by itself, Destination Home can't do much, right? Because again, by design, it's a small piece of the system change effort that's happening. We had the city of San Jose put in $40 million in development. The County of Santa Clara guaranteed the services that are really expensive, right, to provide supportive housing services, and the Housing Authority guaranteed the project-based vouchers. So this sort of supernova funding idea meant that everybody is doing their part with the money that they have, but the total package is like a top shelf solution. And I don't think that's true. I think that is a myth. And I think that's something that people say as concern or fear about creating more resources that, oh, if you build it, people will come. And oh my God, what's going to happen? There's nothing in the data anywhere that ever says that disproportionately of this flocking of people to your community. If you ask COCs, and ours included, our majority of our homeless population is pretty stable. They're from here, they've born here, they've lived here. The ebb and flow of services hasn't created, this stampede coming to our community. But that is a concern that people have, and I don't want to dismiss it as not being important, but I think it's important that we separate sort of fact from fiction. And if you look at the HMIS in San Diego, I would bet that you would see that the core of your homeless population are people that have been living there for a long time. And then also, people have the right to move. We had more people move here for other reasons than homelessness. Especially here in the Silicon Valley, because we are a magnet for all over the world for people. Everyone immigrates here, and so definitely we have a more stable homeless population than a non-homeless population. I know that here we have, if there's a, and I think other communities have this too, that if there's a warm handoff, Meaning, hey, I came out here, I thought I had a job, it didn't work out. My mom lives in Orlando, I just can't get back to her. You call the mom, and the mom's like, yeah, totally, he can come back here, but I don't have the money for a bus ticket. Sure. Do we help support that? Sure. Is that a fraction, tiny fraction of the work? Absolutely. You have to have a coordinated way of allocating resources until there's enough resources for everybody, right? So every community doesn't have enough. And so we did a cost of homelessness study a couple of years ago called Home Not Found that showed us that we spend about $500 million a year on services to homeless folks while they're homeless. And of that number, 10% of the homeless population is half of that money every year, right? So a couple thousand people are costing, $250 million. That's crazy, right? And so we developed a mechanism to understand who folks are that are, I equate high costs with high suffering. People are suffering, or you're not going to the ER 300 times if, everything's fine, right? Trying to coordinate resources and make sure that the right resources are happening to the right people. Not everyone needs supportive housing in perpetuity. So I think generally, historically, communities have had first come, first serve. And what that means is two things. A, that people who probably don't need the help as much are getting it because they're showing up and standing in line and getting there first and doing everything right, right? And also, supportive housing is really expensive. And so do we want to pay somebody's rent in perpetuity when we don't need to? So I don't think that's the right answer, right? And so I think that you either prevent someone's homelessness, you help them for a brief period of time, or they need a permanent subsidy because they're permanently disabled. So the cost study helped us understand that better. The Silicon Valley Triage tool is really an algorithm that uses predictive analysis that says, okay, if you have these flags, you are right now frequent high cost user, or you will be if you don't get housed, right? Because of the pattern of system usage. And it really doesn't come down to a whole lot of different variables, right? And so that is, and that tool is open source and can be used by anybody who wants it. But you have to have a set of linked records. So we had to first go through a lot of work to link all of the data inside the county of Santa Clara. That was important because of healthcare, justice, mental health, drug and alcohol, all the systems, HMIS, all the things that homeless folks use, right? Understand what are the patterns, what are the cost drivers, who's suffering the most, and then how do we house them? And so prioritizing in that way makes sense if you're looking at chronic homeless populations. It might not be how you want to prioritize for rapid rehousing, right? And so I don't think there's just one size fits all, but a coordinated assessment system, which is more the job of the COC, takes into account Triage tool, takes into account the VI SPDAT or some sort of prioritization surveying that says, okay, I'm homeless. I only need a couple $1,000, pay my rent, pay for childcare. I have a job, like I'm going to be okay, right? So that, give me that. Don't give me what I don't need, which is housing for 50 years. But the 65-year-old, right, who has diabetes and is in a wheelchair and is on fixed income isn't going to be okay with a couple $1,000s in, they need help for a long time. Let's give them that, right? And by trying to reduce the system burden over time, that's going to drive the total costs down that are being associated with people that are really most in need. There's a screening that happens, an identification. They say, okay, again, Jen, you've been in the ER 300 times. You've been in inpatient psych. You've been arrested. Like your service utilization, you're one of the higher service utilizers in the county. So you get referred into this Pay for Success program, which is really a housing first program. Mm-hmm. And then as folks are housed, all the service utilization is really dropping off. Ever comes just from private developers. They develop it, but they use public money to do it. The Housing Authority has money, they want to develop a project, they partner with private sector developers or affordable housing developers to develop the units. Historically, funding has been a mix of like tax credits, state money, HUD money, some local match. Everything is like a leverage game, and that's part of what takes so long. Compile all the financing, deal with land use, get the projects developed. We have on our ballot Measure A, which is a $950 million bond for affordable housing with a heavy allocation for the type of housing that solves homelessness, extremely low income housing, because we don't have hardly any of it in our community. Most communities don't. So how do we create more ELI housing? How do we create more supportive housing? Well, that's by giving the local jurisdiction a larger pot of money to use as leverage match, right, to get projects going. The more resources are obviously gives us an opportunity to do more, whether it's a sales tax, a house, some sort of a general obligation bond. There's different mechanisms. LA is doing a housing bond like Santa Clara County. San Francisco is doing something. Alameda and San Mateo counties all have housing bonds on their ballot. We've recognized that we need more resources to mitigate our housing crisis. And then the next layer is how do we allocate that to really prioritize solving homelessness? Because just creating more affordable housing isn't just the answer. You have to do the deepest levels of affordability. You know, this is the kind of political leadership that's necessary. For us, it's hopefully $950 million more over 20 years to address this, and that will be leveraged with state and federal dollars so that we can really, you know, develop, we think, you know, 4,000 or 5,000 units of housing. That's so important. HUD money, and then leveraging tax credits or state bonds or some, you know, whatever the state funding are, cap and trade. Money that can be used to create, so it's not like just the local government is paying for it. You're talking about leverage and blending, which is what happens now, but right now there's generally no local source here for this kind of housing, so create a local source that then can be used to leverage the other sources. Every unit of housing that gets developed, or every project of housing that gets, you know, supported and put on the path to development, is really, really hard, because no one typically wants it where they live. Everyone thinks housing is a good idea. No one wants to disrupt their environment to make it happen. And so this is where the elected leadership is so, so important. Solving the affordable housing crisis, solving the housing crisis, I think is some of the biggest challenges that cities in California have. We have 22% of the homeless problem. If you don't have people elected to your city councils or your board of supervisors that are willing to not only understand housing as a solution, but championing housing in their districts, it's not going to happen, because it's hard, because the general resistance, whether it's for seniors or kids or whoever, is no. Right? And that NIMBYism is understandable because we live in such a fear-based culture, but also not helpful, right, in terms of solving the problem. We get them out of the downtown, get them out of the parks, get them out of the camps, get rid of the camps, no more tents, no more camping. Okay, well, where do you want them to go? Housing is the answer. So you can't just do this. You have to do, you know, both. You can enforce, you don't need people breaking the law, that's not acceptable, right? But create the housing that is accessible and affordable to people who need that kind of housing. Board of Supervisors, our housing authorities, our water districts, right? These are the jurisdictions that can make housing happen. And here, that's the biggest lift that we have, is having all the different jurisdictions agree to affordable, and then how they want to design that for their communities. Mixed use, a mix of teacher housing and service worker housing and housing that's for homeless folks. It's all in the same complex. And who approves the housing is the people that are in our planning and in our housing departments, but ultimately it's our elected officials. So do our communities need to understand the benefits of housing, and do we need to make sure that we're talking a lot about why this is helpful and a good answer? Of course. But then we also need courageous, committed people serving in elected office, or you have rampant homelessness. It is too big of a problem to think it's it's that guy in the tent's fault. We have, you know, so many people that are outside, so many people that are struggling. We have a system failure on like so many levels. And yet there's a really reasonable answer in solving it. But whose responsibility is it really to solve it? Well, I always say, well, where's the safety net? The safety net is here at the county, and our county has done an incredible job of saying, yep, we get it. These are our folks, no matter what. Why don't we serve them more efficiently, better outcomes, heal them, right? And ease the burden on the community. The cities are really important too, because they make the decisions around land use. They have money for development. Here, the county has accepted sort of the nucleus of responsibility for ending homelessness, with the cities being, you know, right at the front seat partners in this, right? But who provides the health care, the mental health care, the criminal justice, who provides these safety net services, I think that's where you have to look. The county is the helpers. They treat the sick, right? This is what you do. So if there's a better way to do it, or if they are coming to you sick and unhoused, well, what's our response? And that's really what we've said is, you're doing it anyways. So let's add this stuff in if they're showing up homeless. For a long time, I think it was just treating the symptom. Homeless people are homeless, and then, oh, well, they see me for psych, or they see me for medical, but not treating, frankly, the underlying trauma, which is a lack of a place to live. Housing is the best medicine that I have ever seen. You don't want veterans, seniors, kids, families, right? Kids aging out of foster care. All of these folks, housing is medicine for everybody. And it doesn't have to be this whack-a-mole game of just moving people all over. It's inhumane. It's not solving anything. And it's making everybody crazy, right? From people who have to mitigate camps to the law enforcement to, I mean, it is a merry-go-round that doesn't need to keep going.